Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent lower leg pain yourself. For pain at the back of the leg, with your shoes on, lift up your toes and place your foot against a vertical surface. Then move your body forward while keeping your leg straight until you feel a pull in the calf muscle. Hold for 10 seconds and do this 3 times a day. This is the soleus muscle. If the pain persists, add the following technique. Sitting with your leg bent, firmly press the edge of a soup can into the calf just above the painful spot, then slowly slide it downwards across it. Repeat the procedure 15 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. If it hurts yet feels good at the same time, you're doing the right thing. For pain at the side of the leg, firmly press the edge of a soup can into the outer leg just above the painful spot, then slowly slide it downwards across it. Repeat the procedure 15 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. This is the peroneus muscle. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If you have less pain when walking and fewer leg cramps at night, it's proof that you're healing and you should congratulate yourself. If you treat yourself as I've described, you should be completely healed in 1 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Light bruising may be normal for some people. If you're taking anticoagulants, take more time and use less pressure in order to avoid excessive bruising. If you're on bare skin, you may want to change the sharp edge of the can for the round edge of a spice bottle and add several drops of hand cream. Never apply heat, including hot baths, since heat increases inflammation. In order to accelerate healing, avoid prolonged standing on one leg, sitting on your foot, and crossing your feet when sitting. Once healed, if ever you feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of lower leg pain, if you heal yourself using my method, it's scientific proof that your lower leg pain was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that if you've been told that you lack minerals, or you can see osteoarthritis, what most people call arthritis, bursitis, Baker's kyst, osteoporosis, spinal stenosis, misaligned vertebrae, subluxations, pinched nerves, a short leg, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of lower leg pain is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. If your calf is swollen, warm, and discolored, you may have a deep vein thrombosis, so get to a hospital immediately. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now, and happy healing.